I want to, while we're waiting for the slideshow, pop up here. Want to say welcome to everybody. Thank you all for coming. Welcome to all of our um, fantastic prospective applicants and our training directors. So my name's Warren Phillips. I am a clinical psychologist and the regional training director for the Cyhawk region, the training consortium. And we've got all of our training directors here from our sites. So what we're going to do today is going to take a moment. I'm going to just walk through a little bit of the history of the National Psychology Training Consortium. I want to try to explain a little bit how the Cyhawk region fits in with the whole National Psychology Training Consortium. So I'll spend a little bit of time there and talk a little bit about the background. And then I want to turn things over to each of our sites and let our training directors talk about um, our sites. We have wonderful, wonderful sites for you to um, hear from. So welcome to everybody who is here. All right. Um, so Amber, if you want to pop to the first slide. All right, talk just a little bit about the National Psychology Training Consortium. So um, before I jump into this, one of the things that I think is helpful to understand is that the National Psychology Training Consortium is just as it sounds. It is a national consortium. So it's all over the United States, and there's several regions. So the Cyhawk region is one of the regions within the National Psychology Training Consortium. The history of NPTC, for short, it was previously called the Heart of America Psychology Training Consortium. That was the name of it when it first came into existence. But it was created back in 2003 through a workforce development grant. Um, and the goal of that grant um, was to provide training for psychologists to work in rural and underserved areas. And that's still really one of the main motivations of our training is to train interns to work in rural and underserved areas. The mission, as it says on the screen, is training tomorrow's psychologists in the discipline and practice of psychology with rural and underserved patients. Um, and so that continues to be the primary focus and goal of the National Psychology Training Consortium. All right, if you want to pop to the next slide. The training that you will get through NPTC, whether it's through the Cyhawk region or any of the regions, but the training that you get is based on a scholar practitioner model um, with a local clinical scientist implementation. Um, the idea behind the internship training is that it's not a specialty training. Um, so you're not trained to be a specialist, you're trained to be a generalist. And so the idea with internship is that you're trained as a generalist of knowledge and methods, and you're focusing on the local realities in whatever area you're working in. Um, you're gathering data, and you may be gathering that data and applying it to a specific case. It may not always generalize to, all cases or all kinds of folks, because it really is focused on that local area. Um, and the other primary goal is that, yes, you are going to learn scientific methods, you are going to be following a scientific practitioner model, but one of the main emphases is for you to develop an inquiring mind, for you to develop critical thinking, um, and to be able to think critically um, and to think innovatively in an innovative manner as you go through the internship training. Okay. If you want to pop to the next one. Now, the National Psychology Training Consortium, as I said, has been around for quite a while, since '03. And many people who go through either as training directors or supervisors or interns at the NPTC stay on as alumni. Right now, across all of the regions in the NPTC, we've got 72 active supervisors who are alumni of the NPTC, kind of went through and did their training there. 7 current site training directors who are alumni, 4 board members, 1 regional training director, 1 NPTC leadership member, and 68 didactic presenters who are alumni. So clearly folks who do their training with NPTC like it and like to stay involved. And of course, that's one of our goals as well, is to, if possible, help you stay involved with NPTC. If you want to go, yeah. All right, so now we get to us, the Cyhawk region. The Cyhawk region has been accredited on contingency by the Commission on Accreditation of the APA as of May 9th, 2025. So we have accreditation on contingency. And so what that means is that we just have to submit 2 years of outcome data by 2027. That's the on contingency part. But we were founded in 2023, and the site training directors that you have here with you today have been involved pretty much since the beginning. Dr. Matt Cooper, who is here with us as well, was one of the founders of the Cyhawk region and is an alumni of NPTC himself, did his internship training there. And so, starting in 2023, the first year we had 2 interns. This year we have 6 interns that are placed in the region. We have, going forward, 5 positions available at 5 sites, each of which is here. There's Blank Children's Hospital. We've got Dr. Jeglum, who's here with us from Blank Children's Hospital, and Dr. Early, who also is the co-training director. She wasn't able to make it, but she is here, and she is also a wonderful training director. We have Dr. Perry from Broadlawns Medical Center, who is also here to talk to you about the Broadlawns program. We've got Dr. Rob Doss from Central Iowa Family Institute, and he's here to share with you information about SciFi for short. We've got Des Moines University with Dr. Lauren, who's here to talk about the Des Moines University program. And we have both Dr. Shannon Welch Groves and Dr. Scott Young from Mind and Spirit Counseling Center, who are also here with us to talk about those programs. We're going to start off with Blank, and I'm going to stop talking now and turn it over to Dr. Jeglum.
Thank you, Dr. Phillips. So happy to be here with you all today. And I also wanted to add, we have our wonderful intern, Ashley Banta, who is also the chief intern of the Cyhawk region for this year. So please feel free to put aside any questions for her too, as someone on the inside. So to talk a little bit more about our site at Blank Children's Hospital, we are located at what's called the Deb and Bob Pulver Center, recently renamed. And so we are part of Unity Point Health. And here we specialize in diagnostic evaluation specifically and ruling in and out co-occurring conditions, things like autism spectrum disorder, intellectual neurodevelopmental disabilities, ADHD, of course, things like anxiety, depression, mood issues, those sorts of things. We are a multidisciplinary team. We have 2 psychologists, 2 psychometrists, which we are so grateful to have, developmental behavioral pediatricians in our office, nurse practitioners, nursing, social work, and a lot of great admin support. In terms of outside of the evaluation aspect, we also do behavioral support, things like consultation, hoping to grow in that area in terms of outpatient clinic supports for kiddos who display challenging behavior, using the applied behavior analysis sort of lens there. I am a BCBA as well, so I am able to provide supervision for both licensed psychologists and for behavior analysts who are those who may be interested in pursuing that. Lots of opportunities then, as you can see. So of course, the primary focus is the diagnostic evaluations. A lot of support also for things like behavioral consultation or parent training, the program development. As I mentioned, we're trying to grow in this area. And so we are currently in that process of building out our space. Of course, no construction yet, but hoping within the immediate future. And then lots more. So a lot of interdisciplinary or multidisciplinary opportunities. Of course, working with our medical providers here, opportunities to consult in other places within the metro region. So things like places like downtown, our Unity Point location there at Blank, or maybe even like Lutheran, those sorts of things. So lots of options in terms of kind of what that collaboration might look like. I don't want to take too much time, so if you want to learn more, please use the fancy QR code, and happy to answer any questions you have at the end.
All right, thank you, Dr. Jeglum. We're going to turn to Broadlawns now, and I'll introduce Dr. Perry, and she will share about Broadlawns Medical Center.
Hi, everybody. I'm Kendra Perry. I'm training director, clinical psychologist, and I've been at Broadlands for 11 years. Broadlands is the safety net hospital for Polk County. So we're located in Des Moines, Iowa. And our mission is to offer high quality, affordable healthcare for all. 70% of the patients that we see have Medicaid and Medicare. So that really drives this hospital and the people who work here. One thing that makes Broadlands unique, I would say, is the comprehensive mental health services offered across our system. So we've got outpatient, inpatient, we've got a behavioral health urgent care, crisis observation center, crisis hall in the emergency room, mobile crisis response, and residential facilities. And so even though we're a smaller hospital, 51 medical beds, 44 behavioral health beds, 30% of what we do is behavioral health. Here we have 4 psychologists, so myself, we have an outpatient pediatric psychologist with his BCA, like Dr. Jeglum, and a board certified outpatient adult psychologist, and then a psychologist focused on physician resident wellness and training. We have a kind of varied staff here, from psychiatric providers, therapists, chemical dependency counselors, clerical staff, and nursing staff as well. And while, BMC, that's Broadlands for short, as a teaching hospital, it's traditionally been focused on physician training. So we're very excited that over the last handful of years, we've been able to expand that to hosting a social work intern, and then most recently this last year by being able to have our first psychology intern. Another part that makes Broadlands unique that I just wanted to point out is we have a unique and diverse client population. So we have 8 different languages offered with in-person interpreters here on campus. And our most prevalent languages right now are Spanish, Swahili, and Arabic. We see your probably higher than typical prevalence rate of schizophrenia, bipolar disorder, personality disorders, PTSD, complex traumas, in addition to all the normal stuff that we all see. Like Dr. Phillips mentioned, we have 1 position available, 2 kind of main rotations. You can do outpatient pediatrics or outpatient adults, or if you are interested in both, more power to you, and we can combine and tailor that experience to you, which we're actually doing this year. And the main duties would include individual therapy. We have many modalities represented here among the therapists, and assessment, and then potential for group therapy. Assessments typically focus on autism for pediatric, ADHD, kind of that learning disorder achievement testing, and a lot of behavioral issues versus trauma, trying to tease that apart, along with IQ and mood disorder as well. For adults, it definitely focuses on diagnostic clarification, ADHD testing, IQ, some neuropsych screening, and memory concerns. The group therapy piece is definitely an option if interns want to have the opportunity to co-facilitate or start a group, even if they wish, that's an option. We'd love to have them do that. We have a significant group therapy program. That's our quickest way to access mental health here. So, and then weekly peer consultation, either with all of the therapists or on the off weeks, it's the temp licensed folks get together and consult. So I think that's about it, but I'd be happy to answer any questions about Broadlands, but anxiously looking forward to next year.
All right. Thanks, Dr. Perry. All right. And so now we'll turn over to Dr. Doss, who will talk about Central Iowa Family Institute.
Yeah, it's awesome having everyone here. At Central Iowa Family Institute, or SciFi for short, we're a multi-specialty group practice in Ankeny, Iowa, just north of Des Moines. And we have services that include individual, couples, and family counseling, but also med management. We work very interdisciplinary. The agency has a very systems focus. Just even if you don't have background in systems or family work, that's okay. I am primarily a kind of DBT and interpersonal therapist and psychologist, and I'm getting a lot of the background just by being here and absorbing it from the culture, which has been amazing. So you could do individual work if you want to, but there are also opportunities for couples and family work. We do take Medicaid, so we have a certain percentage on our caseload that is Medicaid client dedicated. Therapy and evaluation opportunities range basically the entire age range, probably from about 5-ish to, 70, 80 plus. Common evaluation referrals are ADHD and autism. For kiddos, general behavioral concerns like outbursts and mood dysregulation. And we see a lot of mood, anxiety, trauma, rule out some bipolar personality. Once in a while, schizophrenia or learning disorder testing. So quite a bit of variety there. And therapy kind of runs the gamut too. There's really a little bit of everything. I'm sure if there's something that you're looking to do, we have a client on the wait list for you, which is probably true of a lot of the other agencies here as well. We also have started offering a STEPS group, which is like a DBT skills group for individuals with borderline personality disorder or other disorders characterized by emotional intensity or emotion dysregulation. I kind of helped put that in place and have been facilitating it with our current intern. There are other program development opportunities as well. If there's something else that you're interested in doing, a group you want to run or outreach you want to do, sure there are ways we can make that happen. The interdisciplinary discussion is pretty ingrained into the culture. I'm talking with therapists a lot about their therapy clients that they've referred for testing and vice versa with other psychologists who have referred clients to me for therapy. So you'll get a lot of experience kind of chatting, consulting, and following up with other disciplines and other psychologists about the work that you're doing. And then you can work with psychological technicians or psychometrists for some of your evaluations, as well as doing some of your own independent evaluations. So yeah, it's a really, really amazing agency. I'm really happy to be part of it. SciFi also offers the option to do some work with one of our community medical settings, either Mary Greeley or Story County, to provide mental health services in a more medical setting. So if that's something that you're interested in kind of incorporating or doing as sort of a rotation, that is an option, not required. Yeah, that's SciFi.
All right. Thanks, Dr. Doss. Appreciate that. And so now we're going to turn over to Des Moines University, and I will hand it over to Dr. Lauren.
All right. Hi, everybody. I am Katie Lauren. I am a clinical psychologist and the training director here at Des Moines University Behavioral Health Clinic. We are kind of the newbies. We've been hanging around and been part of the development of Sci-Hawk Consortium, but this is going to be our first year where we are actively recruiting an intern for our next academic year. So that's really exciting, and exciting to see some faces of potential applicants and someone who might be here next year. A little bit about us. We are a community mental health center. We do currently serve only adults, so that spans the ages of 18 plus, 18 to 99. Wide range of diagnostic presentations. We certainly see acute grief reactions, adjustment disorders, all the way to schizophrenia, other psychotic disorders. I would say our most common presenting diagnostic issues are in the mood disorder spectrums, anxiety disorders, but there certainly is a range. As a psychologist here, I do kind of the typical outpatient mental health practices in terms of evaluations, neuropsychological testing, cognitive psychological evaluations, as well as psychotherapy. So those would be the primary clinical experiences for our intern next year. Because our clinic is small, but we're affiliated with Des Moines University, and if you aren't familiar, that's really the largest medical school in Iowa. I had to look it up, but we have over 1,500 students enrolled across a range of advanced medical degree programs. So I love, it's almost the best of both worlds that we're a small but mighty clinic here, but affiliated with a large university. So that affords a lot of opportunities and kind of amenities to our interns. In terms of our clinic, our core clinical staff, we are, I would say, still growing and developing. There's 3 of us here full-time. Myself, we have an amazing chief psychiatrist, trained here at DMU and part of the Broadlawns Unity Point Psychiatry Residency Program, who's a huge advocate of training and education. We also have a psychiatric nurse or psychiatric physician assistant. And together we already had a lot of trainees rotating through our clinic. So although this will be our first psychology intern, you will have a built-in cohort right here in the clinic in terms of psychiatry residents who are here for the year, as well as medical students and PA students who come on a monthly rotation. So I like that cohort, not just with the consortium and with the other interns who will be here, but even in clinic. Opportunities are kind of endless. Certainly in addition to your diagnostic evaluation and assessment pieces and psychotherapy, if interested, interns can really tailor the experience. We are pretty much set up for a range of, if you're interested in clinical supervision, we have other trainees who we would welcome some other voices there. There would be training and teaching opportunities and even research that would not be a requirement. But if it's of interest, the university has those systems in place to support and help you develop any of those things. From a lifestyle perspective, I love it here. We were talking about my view earlier, the office. This is the actual office. We're just west of downtown Des Moines, kind of in a lovely residential area, but just a block away is all sorts of restaurants and shops, and we sometimes head out for lunch or quick after work. As part of the university, you'll have access to our gyms here on campus, the online library and electronic databases, as well as tons of campus-wide educational and wellness kind of opportunities. So hopefully that conveys, I think it's a great place, and look forward to hosting an intern. I would say if you have interest in, or your long-term goals are headed towards an adult outpatient clinical setting, whether that be community mental health or perhaps a group or private practice, this would be great training for you. I think you'd get great experience and education and leave feeling confident and well prepared, and we would love to have you next year. So any questions, happy to answer them today or tomorrow, next week, next month. Please reach out so we can help you make a good decision on your applications.
All right. Thanks, Dr. Lauren. That was wonderful. Okay. Mind and Spirit Counseling Center is up next. And so I'm going to turn things over to Dr. Welch Groves and Dr. Young. So the floor is yours.
All right. Thank you, Warren. Hello, my name is Shannon Welch Groves. I'm a licensed psychologist here at Mind and Spirit Counseling Center. And Scott and I are the co-training directors for Mind and Spirit. So at Mind and Spirit, we were fortunate. We had an intern placed here last year. We have a psychology intern placed here this year again, and we're so excited about our work with the consortium. We are very focused on our mission. We're very mission driven, mission focused. We have all of our clinicians are. I think that's why everybody's here. I think that's why everybody stays here and loves our center, because our mission is to walk with people through counseling and education to find hope and healing, and to live a fulfilling life. So that's kind of our motto, and that's kind of what we focus on, is helping all people, regardless of the ability to pay. We have sliding scale clients, we have Medicaid, we have Medicare, we have a robust training program and education program. So we do a lot of education internally with our staff, as well as offer that outside of the center, and most specifically to our trainees. We've had trainees. I think Scott's going to talk a little bit more about that here shortly. But we've had a training program for a long time. And so we're just so excited to continue that. Regarding our mission, like I said, we work with all different persons. So our name is Mind and Spirit Counseling Center. So we do offer spiritually integrated psychotherapy. That's an offering. We are comfortable with that. We're open to that. And we also are not a Christian counseling center. So our clinicians here are very diverse in their faith traditions. So we have clinicians here that identify as Christian. We have clinicians identify as Jewish. We also have agnostic clinicians and atheist clinicians. So we do not identify with a specific religious community. However, we do offer spiritually integrated psychotherapy. So that's something that's a little bit unique for our center, that's something that we teach and we offer. But we also see clients of all faith and non-faith traditions. So it's very inclusive, very incorporating of lots of diverse beliefs. And that's a real important value of our center. We are a nonprofit clinic committed to high quality and affordable mental health services. So we have our adult and children unit, which we call COOL, which stands for Children Overcoming the Obstacle of Life. And then we also have our adult side that does fantastic care for adults, couples, and the adult side also sees some older teens as well, and older adults as well. So we do all ages. I see children as young as 2 up through older adults as well. I like the variety. So our interns can do that. They can have variety, or they can specifically focus where they want as well. So there are options with our training program. Specifically, since I see children, I'll talk a little bit about our COOL program. We have a really unique unit, which is so child-focused. Our waiting room is child-focused. We have a really, really exciting, you could check out our website, a really exciting art and playroom. And then we call the beanbag room, which is our area for kids to move. It's full of beanbags, and they can move and they could jump and they could do all the things that kids need to do to process things and to move through different feelings. So those are a couple of highlights I wanted to share. And now I'll turn it over to Dr. Scott Young.
Thanks, Shannon. So my role at the center is I'm the Director of Psychological Services, and Dr. Welch Groves is our Director of Clinical Services. And I'm also a conditional prescribing psychologist, one of the 4 prescribing psychologists here in Iowa. So along with Dr. Cooper, we have 50% of the prescribing psychologists in Iowa on this call. And, I would just really reiterate what Dr. Welch Groves said. We have been really focused on training very close to the beginning of the center. It's really written into our DNA. And that's changed over the years in terms of we were beginning to focus on pastoral counselors, and we've had training focused on master's level clinicians. And we've been fortunate more recently to be able to really focus also on postdoctoral fellows and our predoctoral internship program. So it's really something we all care a great deal about. And it's a really central part of who we are. And in addition to the psychotherapy offerings, we have a lot of other opportunities as well. So there's a lot of variety of different testing cases that an intern could participate in. Those can range from kind of your common differential diagnosis cases of ADHD, autism, those kinds of things, to some neuropsych screening for memory issues and those kinds of things. Clergy evaluations. We have a lot of complex cases as well. I have one right now that I'm working on that I'm starting to go a little bit cross-eyed with how many things I'm trying to keep track of diagnostically. So there's a wide variety of cases. I would say if you want simple testing cases, we don't get a lot of those because every time we think we've got a simple one, it turns into not. So there's also opportunities to get involved with some little bit of exposure to some health and behavior interventions. Again, prescribing medical psychology. We have an interdisciplinary staff with our 2 psychiatrists, our psychiatric nurse practitioner. We have a good group of master's level clinicians, clinical social workers, marriage and family therapists, mental health counselors. And we are also very proud to have 9 fully licensed psychologists. So we have a very strong culture and a cohesive group of psychologists. And we're very fortunate. We've got a good group of people that we can meet and consult twice a month amongst the psychologists and really talk about some of our unique cases and challenges and go over testing cases, those kinds of things. And so we're really, really excited to be able to continue to participate in the consortium. And as Dr. Welch-Groves said, we're looking for intern number 3. So we're excited to have you folks with us. Thank you.
All right. Thank you so much. Excellent. So you've heard from each of our sites. And as I'm sure you can tell, every site, in the Cyhawk region is just really top quality. You've got, amazing supervision, lots of opportunities across all the sites. Every site is, a little different and has some specialties, but each site is just a very, very strong clinical training and wonderful opportunities. So this is an opportunity, speaking of that, for you to now ask some questions. And you can feel free, you can ask sort of general questions. If you have specific questions for specific sites, you can do that as well. So I will turn it over now to all of you who are here. So what questions do you have for us?
Hi, Dr. Phillips. Thank you for the presentation. That was really, really informative. I was wondering if you could speak a little bit on the opportunities, like through the entire consortium, with one intern being at each site, for interns to get to know each other and learn together, and sort of what those opportunities and that training looks like.
That is a fantastic question. And actually, I think I'm going to ask our chief intern, Ashley Banta, if she could pop in and talk about that, because that is one of her primary goals. So not to put you on the spot, Ashley, but if you're open to it, I think you'd be wonderful to share a little bit about that.
Okay, I saw it coming, so yeah, that's a great question. We're unique this year and we're a little spread out. There's 4 of us kind of in the more Des Moines area, and there's 2 in Cedar Rapids. I think that's unique to just this year. And then in the future, it sounds like we'll all kind of be in the Des Moines area. So within a reasonable drive of one another to connect. So far, we had like a training at Sci-Fi 2 days where we got to all meet each other and exchange contact information. We have a group chat. I've actually had some questions that I've already sent to interns like, hey, are you doing this? And I've gotten responses right away from all of the other interns, which has been great. I do think we want to really prioritize getting together again because we're in a similar situation, right, as all being interns together, and so we have plans to try to get together, especially around like some of the holidays coming up. I've gotten some good ideas so far from my supervisors who have told me what they did as interns. So yeah, we have group text, trainings together. We have our didactics every other Friday where we're able to see one another, which helps us stay connected. And then, yeah, opportunities to get together, I'm hoping in the future.
Thank you very much.
All right. Thanks, Ashley. Anybody else want
Yeah, I had a
chime in?
question.
Yeah, please.
So directed a little bit towards Dr. Jeglum, but also everyone. So I'm interested primarily in like neurodiversity testing and then specifically children, but also love that this program is to make a generalist. So I know that there's opportunities like at other locations and things like that. How much are we able to kind of pop around between different sites to get also other learning opportunities? Because I also was focused on Blank Hospital, but also hearing from Mind and Body, like that also was like really cool too.
Yeah, I feel like, we're so open to discussing what this might look like, especially as we continue to grow. So of course, this is Blank Children's, this is our first year of internship. But in the future, I definitely think, we would love to be able to do more collaboration between sites and whatever that looks like. Of course, logistics aside, I could see things like, maybe it would be a few opportunities of, like either shadowing or, helping out, or maybe it is more of a contractual sort of thing that we kind of try and figure out how to do. Of course, can't make any promises in that regard right now, but know that, us as supervisors, like, I think this is part of the reason why, they probably don't allow us to like have so much power over things, because we're like, yes to everything. How can we do this? Thankfully, I think our support here, they really just want to support us on the administrative side, like, what do we want to do? How can we do this? And let's just figure it out. So yeah, I definitely think there are some of those opportunities. And I'll share too, last year I was able to work with the Mind and Spirit intern to do some ADOS training and do some support there. And that worked out really well. So, of course, we're all in the same family, the same consortium. So, however we're able to support one another and get those opportunities to our interns, we really prioritize.
Yeah, I can talk a little bit about that too. Just because, yes, that's what I was thinking of too. That we had, so last year we had a psychology intern that was really excited about testing for autism, and we didn't have someone that was trained to supervise someone on the ADOS. So it was so wonderful that we could work with Dr. Jeglum and coordinate that supervision so he could practice here in a general format where he saw kids, in therapy. He did work with ADHD and autism and family systems and things. And then he also did assessment. He was really heavily focused on assessment, actually. So that's why we really we have a really strong group, like Dr. Young said, of psychologists here. But he wanted to do even more as far as like the testing for autism. So it was so great to get to work with Dr. Jeglum, and we had a contract and it worked really well. But without even looking outside of our center, we also do for children, ADHD, What else? Scott, help me all that we do learning disability. We do for our child focus. Can you help me? Scott, our primary assessment supervisor for psychologists. So what else do we do, Scott, for assessment for children?
Yeah, I mean, in addition to the ones you mentioned, intellectual disability waiver testing is something we have a number of referrals for. Again, just kind of differential diagnosis. Sometimes, like for example, med providers will need some testing to figure out what's going on, so they can gauge treatment. Insurance companies, being what they are increasingly particular about what they want to pay for, and so there's some increased demand for testing to help establish diagnosis and monitor medication treatment progress in order to get prior authorizations for medicines. So there's actually quite a bit that we're doing with kiddos and adolescents.
Thank you all for that answer.
Hi everyone, I'm Aubrey. I thank you first and foremost for being here and for the wonderful presentation. I've learned a lot from all of your presentations today. I have a few questions for Dr. Lauren, Dr. Doss, and Dr. Perry. I have two main questions, and the first one being, what does supervision typically look like weekly? And my second question is, in my training so far, I've really been interested and really found benefit and outreach throughout my training. And I'm also wondering if that is something that interns can take part in at your sites.
I can start
Go ahead.
and talk about DMU, at least kind of what our plan is and kind of what I'm thinking. I didn't mention that even though I'm the only licensed psychologist here full-time in the clinic, there are other psychologists and we already have them signed on as supervisors. So it'd not just be a single primary supervisor's voice that interns would be exposed to. We have a couple of great other psychologists who are going to work with our interns too. So in terms of how supervision works, obviously there's the minimum of 4 hours. I think you're going to get that and then some. Just in terms of 2 hours would certainly be individual one-on-one with myself and/or the other psychologists. We also have, I love group supervision. I do with the psychiatry residents, we do group supervision over their therapy cases, which is great because it's just an opportunity to learn from each other. And sometimes hearing the case as an outsider, I think putting our heads together just helps us all grow. So our intern will definitely be involved in that. And then I think a lot of it's also beyond the 4 hours, just informal. It's just kind of, we chat in the collaboration rooms, we chat sometimes just over lunch, just about what's going on and multidisciplinary within us. So that's kind of the supervision plan, and again, very tailorable to whatever the needs are. Outreach, we do a lot of, we get invited to a lot of events, especially as representing DMU. So we just did a African American women's event here in town. We did a Mental Health Matters event here in town. We're always involved in the NAMI events, that kind of outreach. And other opportunities we could explore. I know a lot of our medical students and residents do work at the free clinics here in town, and that's not necessarily something we contractually have involved or would be a necessity for an intern, but it would certainly be a potential opportunity. So yeah, definitely depending on interest, there's varying things that we could try and probably make work.
I can go next. Ours is going to be similar at Broadlands. So the 4 hours per week with a minimum would be 1 hour with your primary supervisor. If you were doing all adults, maybe it'd be 2 hours with that person. Our current intern is meeting 1 hour with each of our 2 psychologists up here, and then an hour with an ancillary supervisor, so one of our master's level therapists. And then we get that 4th hour between, the peer consultations, the staff meeting, those types of things. Outreach, again, kind of similar to DMU. We've usually got some sort of monthly event happening. I think we did bike helmets for kids here last month, and we're going to participate in NAMI, just like DMU's got a team. Vaccination clinic was held over the summer, focused on refugee population. So there's usually, I'd say, something monthly going on, where someone could be involved if they wanted to. So that's for Broadlands.
And for sci-fi, similar answer regarding supervision, the 4 weekly hours, and that can range from the structured weekly meetings. I've got a weekly meeting set up with our current intern, and he has meetings with other supervisors as well. But also just my office is open. He walks in and says, "Hey, I have a question," and we talk for anywhere between 1 and 30 minutes, depending on the question, and whatever needs to be addressed gets addressed. Sometimes that looks like a debriefing after a steps group, like we did this last Monday. It was just one of those sessions, and we just kind of chatted for a little bit afterwards about how do you feel like that went, and what do we need to problem solve and maybe do in the future. So that's kind of how that looks. I can't speak for other supervisors, but from what I've gleaned, it seems like a lot of people take a very developmental approach. So NPTC structures supervision around your individual needs, your learning goals, and your areas where you want to further develop. So some of that will be based on what do you want to know more about, things that you're strong in that you want to do more of, and then things that you kind of want to round out, things that maybe you don't have as much exposure in, that maybe you get some exposure in, or a little bit more experience in at your respective site. So it's really, really tailored to you, whatever your individual needs are. And topics of supervision vary accordingly. As for outreach, Sci-Fi is a relatively new agency, so there's a lot of things that are still in development. We've got a very solid testing and therapeutic intervention wing, and I think there's been some talk about how do we make ourselves accessible and visible to the community, right? And so we are very open and receptive to ideas about that. I know our previous intern had expressed interest in maybe doing some school-related outreach pertaining to experiences that she had had, and just kind of educating schools and teachers and parents about, she did a little bit of questioning about how do you advocate for your child, right, to receive services in a school setting, from like a 504 plan and the IEP. And she was talking about maybe kind of bringing that to parents in a more direct way. So I think something like that could be, certainly under the purview of something that Sci-Fi does, if that's something that you're interested in. Hopefully that answers your question.
It does. Thank you all so much. It's very helpful.
I have a question. My name's Carolyn Turo. I'm here in Tucson, Arizona, and I was teaching a class, so I couldn't get an opportunity to hear Blake's presentation. So nice to meet everyone. I heard that this would be your first time taking an intern, so I'm very curious about how are you planning to make this kind of rotation for your interns? I know you have a lot of support, but I'm just curious of what are your plans for having a first intern?
Thanks for that question. And yeah, sorry that you weren't able to make it, but totally understandable. So we do have our first intern this year. So Ashley Banta, who's here, is actually our very first intern. So she's been wonderful. And, obviously we're welcoming a lot of feedback kind of throughout because, as you're hearing, I think with everyone so far, we're very much collaborative and want to make sure that the intern is comfortable and that we're meeting them where they're at. And so a lot of what I think we strive to do here at Blank is, really solicit feedback while also making sure that all of those needs are met. So NPTC has some great resources in terms of, the overall, what does APA need and, all of those sorts of things. But in terms of how to make sure that the intern is getting everything and kind of that structure, we do try to individualize and make sure that, there's a comfort level in, that open space of sharing. I hope that answers your question.
Yes, thank you. I had another couple questions for Dr. Doss and the Sci-Fi Center. So I really appreciate sort of the generalist approach to the program. I feel like that's very in line with my academic training and clinical training so far. But I have had like an interest in couples work that I haven't gotten a lot of exposure to. So I was wondering if you could speak a little bit more about the couples and family systems like training opportunities that you have and sort of like what that looks like and what models you guys use.
Yeah, so I might lean on Dr. Phillips slightly for this answer. What I can tell you is that we have a lot of great couples, family, and systems providers. Dr. Jacobs, the founder of this institution, is extremely family and couples and systems focused. And I don't know whether he is a listed supervisor for us, but he is a accessible person and resource, and would be more than happy to draw on a big whiteboard in front of you about clients and families. I met with him one time. Oh, I met with him one time about a client whose family he was seeing, and learned about as much as I think you could learn in like a semester of a systems class. So he is just a wealth of knowledge in that department. But Dr. Phillips, maybe you can add a little bit more if you don't mind.
Yeah, for any intern who would be interested in couples and family work, that's something where that could absolutely be a pretty significant part of the work that you would do there and the training that you would get there. That could be, both Warren Jacobs, as Dr. Doss was saying, can do some supervision there, as well as myself. And we primarily use a systems approach to both couples therapy and family therapy at Sci-Fi. And so while you might, from a couple's end, while you would also be exposed to and learn things from, for example, an attachment-based, emotion-focused approach, you would also learn how to utilize systems approaches as well. So those are, and from the family perspective, pretty much all the systems approaches that you could imagine get utilized for families there. Whether it's structural or strategic or communication-based systems approaches, those kinds of things. So.
Thank you very much. That's very helpful to hear, and I'm excited about those opportunities for that. I also wanted to ask, with being a private practice, if there were opportunities to sort of shadow or have conversations or discussions about sort of like the administrative, like business elements, because that's something that I am out of my depth with understanding and would love to get some insight onto like what that looks like in terms of looking forward and ahead in my career. So
Yeah, that's something I think that's available at most, if not all, of the sites. So I'll sort of allow the different sites to share a little bit about that, because you're right. I mean, it's not something we typically get any training in graduate school. So, but it's vital to have some information about. So I'll turn that question over to everybody.
Well, for Mind and Spirit, I guess I'll speak for myself. Even though we're a nonprofit, we function a lot like a group private practice. So yeah, there's definitely opportunities to learn about the business side of practice, all the different procedure codes. I don't know, maybe Dr. Cooper might rival me, but I'm guessing I probably use more CPT codes of different kinds than anyone else on the call. So there's a lot of them to learn, and a lot of opportunities to kind of get a better sense of how do you serve your clients? How do you manage the joys of insurance companies, those kinds of things. So
I can go next. We have a coding department, so we've got someone kind of looking through all the notes, so we could give you a little bit of exposure to that. Certainly, we talk about productivity and what that looks like and what value each CPT code has and what diagnoses are covered by insurance, as Dr. Young mentioned, and which ones are better covered or which, the requirements of that piece, which I think is helpful. And then denials, if we get those, kind of working through those together, and then any pre-authorizations for testing. So we can give you some exposure. It probably would look a little bit different than a private practice setting, just because we have a department who focuses on reimbursement and just lets us know if there's an issue, and same with coding. But we could definitely give you a little bit.
Yeah, I would just say we're at Blank Children's, we're about at the same as Dr. Perry said. We have our own coding department who let us know if there's any issues. I do feel that, we're able to provide a little bit of support in terms of, okay, like here are the codes that we use and, why we would use these versus others and those sorts of things. Of course, pre-authorizations and all of that. I do think that, program development, since that is something that we're trying to do in terms of developing our own intensive outpatient clinic, of course, there's the clinical side of things, but then there's also the business side of things and, doing the business plan and proposing all of these things. So, I think there certainly could be room for some exposure to that, just depending on the intern's interest and comfort level with that.
I would say just one additional add-on. I think we all would probably agree that being part of IPA or Iowa Psychological Association would be great while you're an intern here, and so many connections through that. I mean, not just like for myself, work at DMU, but I have done private practice, so would be happy to work with any interns at any sites and stuff that I don't know, which is a lot. But there are folks out there who do that full time, and that's their bread and butter. And we could easily get you connected to all the right people and just kind of help you make those connections and get the information that you need, even if it's not kind of how our specific sites run.
Thank you very much. That's really helpful and really informative.
If we have time for one more question, I have one more question, and it's for the entire consortium. So us individuals that might be licensed master level clinicians, what is the policy or expectation if we were to want to work outside of the internship program for extra money or anything like that? Is there a non-compete clause or anything like that for this consortium?
There is not I'll speak generally, there's not a non-compete at the consortium level. It really is up to each site, kind of, how they would want to do that. The only thing you want to be careful of, and this is just the one caution, is, APA does have certain guidelines in terms of, the amount of hours that, you do a 40-hour work week. And so you would just want to be careful because out of that 40 hours, a fourth of that, so at least, 10 hours needs to be devoted to direct clinical contact. So if you were working with a site and that site said, yes, we're okay with you doing, something, a little bit elsewhere, you'd want to be careful that you're not counting that as part of your 40 hours, because if so, then that would mean it's going to throw your balance off, and then you'd end up having to do more client contact. So that's just the one sort of little cautionary statement, but I think it would be site by site would be the the discussion to be had. But that's a great question. So anybody want to add anything else to that?
I think I
Yeah.
did that. Oh, sorry. I just was going to jump in as a current intern. I do have permission to do psychological testing at Sci-Fi, even though I'm at Blanks, but I don't count the hours at all towards my 40 hours a week.
The only other thing I would add is that this doesn't get you any money, of course, but there's plenty of things you can be doing besides the internship while you're on internship. Our current intern is studying for the EPPP, for example, so that she will get that knocked out probably before she's done with her internship year, and she'll have that in place before she goes on her postdoc. So there's plenty of things that can occupy your time productively if you're somebody who gets bored easily.
As well as I'll throw in just having a good work-life balance and, you know, enjoying life outside of your 40 hours too. You know, let's not forget about that one.
What's work-life balance, Dr. Phillips?
Thank you for that.
You're welcome. You're welcome. All right. If you have other questions, because I think we're at time, is that right, Amber? Yeah, if you have other questions though, please feel free to reach out. You can reach out to me if you have questions, you know, and I can disperse those. You can reach out to individual sites. You can reach out to the NPTC if you have additional questions or questions pop up, and we'll be happy to get back to you and answer any questions that we can. And I just really want to thank all of you for coming, asking amazing questions, wonderful questions. This is a great discussion. And I want to thank all of our site training directors for being here and, you know, just doing such an amazing job of talking about this wonderful consortium that we have. And I want to thank Amber and NPTC for hosting us as well. So, all right, have a wonderful rest of the day, everybody. It was very nice meeting you all.